So I am particularly interested to see the health strand in Cannes Lions, and see the way that people are talking about how they interact with their patient bodies. I think it's a really interesting way of now starting to see healthcare organizations as brands in their own right, and how they need to interact with their customers, and an interesting corollary parallel to the main, the traditional end of Cannes Lions being the marketing side of things.
I think it's very interesting, and in my family, my father was a surgeon, so the medical and the sort of empathy that comes with it has always been part of what I grew up with. And I do wonder, the sort of stuff that we are looking into, the emotion stuff, how will that bring that sort of empathy back into the system? Because I think nowadays the whole way of looking at someone as a patient, it's not very holistic. And emotions it's something which is extremely holistic and it's extremely personal. So when we talk about personalized medicine, that's one of the strongest points.
So my view is that that when we access the healthcare system, generally that's a failure of wellness management. By the time we've got there, generally something's gone wrong. Clearly there are some things you can't do anything about, but so many major issues in our society around mood issues and mental health issues, many cancers, obesity, smoking-related illnesses, drinking and addiction illnesses, they all come from an emotional cause. They come from an out-of-control lifestyle where something has gone wrong in some way, and end up as a healthcare issue that costs the economy and the individual money in the process. And as you know, my passion is in using technology to understand how human emotion actually works, to quantify it, to measure it, and by measuring it to be able to actually affect it and to be able to provide solutions back to the individual and to the economies which improve overall wellness.
And we look through the technologies that we are working with, like virtual reality and augmented reality. We look at this path of almost accelerated time lapse. How we can influence decisions now, if we can see how things will look like in 20 years' time.
Yeah.
Is there something in this sort of medium that allows us to do that?
That is fascinating.
So that we don't just see a cigarette or a cancer on a packet of cigarettes, but actually we pick up some virtual decisions.
Absolutely.
And see how it will look like in 20 years' time.
Well, you were saying this morning about VR being the empathy machine, that it allows us to walk that mile in other people's shoes.
Yeah.
Just as you say, you could use it to allow the individual to walk in their shoes in 10 or 20 years' time, allow them to actually experience firsthand the impact of the decisions that they make in their life. It could be huge, actually.